Good afternoon and welcome. We are going to give it a minute just to let people join in before we kick off. In the meantime, I'm going to drop a quick question into our Q&A chat to get everyone familiar with the feature. And I'll ask my panel of speakers, does anyone have fun fall plans for the weekend?
I'm all fall
Going
tapped out.
pumpkin picking.
You say you're all falled out, Amanda?
Yeah, last weekend was a full fall affair, so this weekend we're laying low.
We'll be carving
We're
our
getting
pumpkins this weekend.
Yeah, same. We can take the kids to go get them, and then we'll be carving them. I love doing that.
And then
Do
probably
your kids make
watching
you-
the Giants lose again.
Oh, no.
Par for the course. So.
Do your kids make you take the guts out of the pumpkin?
They do.
Yeah.
They do. That's okay. They actually like playing with them afterwards. They like to separate out the seeds.
Oh, that's crazy.
Yum.
All right. So we're just at about a minute now, so let's get this kicked off. Thank you for joining our webinar today on improving the affordability of pharmacy care. We know many people count on prescriptions to stay healthy, and for businesses, that means pharmacy benefits are a very big part of taking care of employees. So the challenge with this is that they're also a very big driver of costs. So with that in mind, we want to make sure our employers and members are getting the most from their pharmacy benefits and are aware of everything we offer. And so our goal for those listening today is that you learn something new about one of our programs or clinical teams and are able to pass that knowledge on. If you have any questions during the presentation, please feel free to put them in the Q&A chat. If we have time at the end, we will try to answer any questions, but if not, we will make sure a sales rep reaches out. I am your host, Kristen Wuckelchuk, and I'm a marketing manager on the pharmacy team. Today, I am joined by our speakers, Amanda Wegman, who is a director of pharmacy strategic planning, Molly DeVries, who is a manager on our member care management specialist team, Amanda Slater-Hines, who is also a manager on our care management team, and Chris Deal, who is a director of pharmacy clinical programs and education experience. We are going to start things off today with Amanda Wegman speaking to the specific pharmacy programs we have available to help bring pharmacy costs down. And from there, we will take a deeper look at the medical and pharmacy clinical teams that work together to provide integrated and coordinated care for our members. Before I pass it off to Amanda, I wanted to highlight our mission to help people in our communities live healthier and more secure lives through access to high quality, affordable healthcare. It's what guides every decision we make, including our approach to pharmacy benefits. And with that, I will now be passing it off to Amanda to talk about our pharmacy solutions.
Thank you, Kristen. Hello, all. I'm Amanda Wegman, the Director of Pharmacy Strategy here at Univera Healthcare. As Kristen mentioned, I will be covering the pharmacy solutions that improve affordability for our employer groups and members. I'd like to first make sure everyone is well aware that our pharmacy program offerings expand well beyond what you see on this slide. We have over 40 programs and formulary management strategies that aim to contain cost. But unfortunately, I don't have the time today, nor can I really imagine you would want to sit through all that. So starting off with the backbone of our strategies is our utilization management programs. These will be included for our fully insured groups and optional for our claims-based bill groups. These 4 robust strategies all drive savings through the appropriate utilization of medications. With prior authorization, our clinical pharmacists and physicians review medication requests to make sure that the choice of drug or dose is appropriately prescribed based on FDA manufacturer guidelines and clinical standards. Within our PA policies, we have a number of different strategies like advanced condition intervention and high cost, low clinical value that are critical in driving affordability. Moving on to step therapy, here we have edits in place where utilization is managed through a series of steps. So certain medications are not covered until one or more equivalent and typically less costly medication is tried first. With quantity limits, it is exactly how it sounds. We have system edits in place to limit quantities to be sure prescriptions are in line with FDA-approved dosage guidelines. And last but certainly not least, biosimilar optimization. Much like a generic is to a brand drug, a biosimilar is highly similar to its reference biologic. However, it is not identical due to its complexity. Biosimilars represent one of the biggest opportunities to improve access and affordability for our community. We include biosimilars in all 10 drug categories in which biosimilars are available. Now we will move on to pharmacy concierge, which applies to fully insured groups and is optional buyout for our claims-based bill groups. Pharmacy concierge is a retrospective management support program that identifies prescription savings opportunities and provides recommendations on less costly treatment options through a peer-to-peer outreach. Our team of pharmacists and outreach coordinators works directly with the prescribing physician to review treatment options. Now, the reason we created this was because the majority of our employer groups have utilization management already in place, like PA and step therapy, but we are still finding savings opportunities that were identified after the fact. We know that there are only so many things that we can PA and apply step therapy to before there's provider abrasion, so this retrospective approach is critical to addressing those outliers. As you can see here, for our employer groups enrolled in Pharmacy Concierge in 2023, there was a combined savings of over $19 million with an average savings per conversion of over $3,100. So on the previous slide, you saw how successful the program was for our entire enrolled population. Here you will see how one of our strategies, like a simple package size switch, has saved significant dollars for one of our large employer groups. Through Pharmacy Concierge, our team identified as savings opportunities for members that were prescribed Cosentyx. So now Cosentyx is a costly injection that is used to treat a handful of inflammatory conditions like plaque psoriasis or psoriatic arthritis and is available in different package sizes. Many of our providers aren't even aware of the cost differences when prescribing medications, which makes Pharmacy Concierge so valuable. Through the program, we identified the patients receiving the Cosentyx and reached out to their provider to recommend switching the prescription to a 2-pack, as the cost is the same as a single syringe. This simple switch saves on average $45,000 per conversion, and for this specific employer group that has been enrolled with the program for over 4 years now, has saved roughly $500,000 on this one strategy alone. Now, we all know that specialty drugs contribute to a significant amount of spend for our employer groups on both the pharmacy and medical benefit. These next few slides will cover the programs we offer to help drive affordability in this arena. When it comes to coordinating care for our members, our team really does it all. We coordinate everything from identification of the members, outreaching to these members, coordinating the transition from the facility to the home, getting the script from the doctors, and ensuring that the scheduling is complete. Not only do we offer members the option of switching from a hospital to a home infusion or a lower cost facility, we are also checking to see if there's a different formulation of the medication where the member can learn to self-inject instead of needing an IV altogether. The goal of the site of care program is to continually monitor our group's claims and look for opportunities to transition these members to a lower costing setting. This can generate significant savings for our employer group customers while offering a more convenient solution to our member. As you can see on the right hand of the slide, one example of facilitating the transition with a member saved over $43,000 annually. So one thing I did want to take a moment to remind everyone on is that we have rolled out a required version of the site of care program, meaning that if a lower costing option is available to the member, they're required to use the lower costing option. All of our insured business will be enrolled in the required version as of January 1st of 2025, with our claim-based billing groups having this as an option. SmartRx Assist. So this is one of our newest programs that just became available for self-funded groups on July 1st and aligns to our mission to drive affordability. I do want to note that this is only applicable to copay and hybrid plans, and high deductible health plans are not eligible. This is a program that can provide our self-funded groups with significant savings on medical specialty drugs. These are specialty drugs processing under the medical benefit. These specialty drugs are typically administered as an IV infusion in an outpatient facility and are some of the costliest treatments impacting employer group medical spend. So now how does it work? SmartRx Assist identifies manufacturer assistance dollars in the marketplace for select drugs and allows employers and members to share in those savings. One highlight of this program is that it is administered in a way that there is no disruption to the member and eliminates their copay responsibility. A true win-win in my mind. But before I go off the slide, I did want to make you aware that SmartRx Assist is going through a brand name change. So in the next coming months, you will see the program name change from SmartRx Assist to HelpScript. So be on the lookout. Next up is our Save On program. This again is only available to our self-funded clients. Similar to SmartRx Assist, Save On is a benefit that takes available manufacturer assistance in the market and allows our employer groups and members to share in those savings. But for Save On, these are for drugs and claims that process are under the pharmacy benefit. Save On is an important lever to drive affordability as it provides financial relief to some of the most costly treatment options in the pharmacy space, ranging from oncology to cystic fibrosis. As you can see, our self-funded employer groups have seen significant savings by participating in this benefit. Throughout 2024, our employer groups save on average $543 per patient per month. I also wanted to call out Save On Adapt, which is a version of Save On that is available to our high deductible health plans. So with Adapt, the Save On benefit does not kick in until the deductible is met. This benefit must be added at the start of a plan year as it needs to align with the member's accumulator. Keeping with the theme of specialty medications, we offer a unique, completely volunteer program that is available to our self-funded groups known as Medication Assurance Program. We are all aware that the specialty landscape is growing and growing at a rapid pace. Some of the drugs coming to market enter through the FDA accelerated approval process. With accelerated approval, it can leave plan sponsors covering drugs that have not been fully proven to be effective clinically. And we have seen examples where accelerated approval drugs are covered for a number of years, only then to be pulled from the market because they did not show a clinical benefit. With medication assurance, we monitor these accelerated approval drugs and hold the manufacturers to a financial guarantee that their drug will meet program requirements. For our groups that elect the program, if a manufacturer does not agree to participate, their accelerated approval drug will not be covered. This helps provide an option to our self-funded employers to hold these manufacturers accountable that their accelerated approval drug will be proven to be clinically effective. Now, the last solution I'm going to touch on today is our network options. These are only available to our self-funded groups. We offer 2 network options in addition to our broad network. Through our limited network, employer groups can experience increased discounts through the participating pharmacies. This benefit typically generates up to 2% savings on prescription drug costs. Our limited network excludes CVS and Target pharmacies while still maintaining over 43,000 pharmacies in network. Another network option we have is Smart 90. Much like mandatory mail order benefit, the Smart 90 network requires long-term maintenance medications to be filled through either ESI home delivery or a major retail chain that is chosen by the group. Both CVS or Walgreens are the retail options available for Smart 90. This unique plan design offers deeper discounts and increases member adherence. And before I pass it over to Amanda, I did want to reiterate that we have many solutions and options available for our employer groups and members to drive affordability. And really the purpose of today was a high-level overview of some of the options that we had. So with that, I will pass it over to Amanda to review the care management strategies that we have.
Thank you, Amanda. Lots of great information, and thanks for everybody that could join us today. I see some familiar faces, which makes me slightly less nervous. So thank you. And I believe I've got the control here. So we'll jump in. So our case care management model is an all-inclusive, holistic, integrated approach. We work collaboratively with all of the clinicians you see listed here, and I'll just add physical therapists to that list as of recently. We have a process in place to solidify that we can connect with a pharmacist as we're completing our assessments with our members that we engage and reach. We have pharmacists of the day if there's an issue regarding obtaining the prescriptions in a timely fashion, potentially cost savings if to convert to mail order or 90-day. That process has been in place for a while now and works very, very well for us and for our members, and we are grateful for that collaboration. We get a lot of support from our medical directors in terms of conversations. Is this the medication that's the most appropriate, most effective, and best suited for the member and what they're going through? Our registered dietitians, who my colleague Molly is going to speak more to in a little bit, are amazing at working with our members, specifically around dietary needs that deal with cardiac health, diabetes, weight loss, and I'm sure she's going to give you way more information on that in a little bit than I can. We have our behavioral health specialists. So in addition to the licensed social workers, we also have licensed LMHC, so mental health counselors, licensed art therapists, substance use professionals, all present to assist the member and review medications that are best suited to meet their healthcare goals. And then, of course, our amazing registered nurse care managers who have experience from ED, oncology, home care, you name it, we have them, and they're amazing at what they do and how they do it. And together we are all united under one senior leader, and we work very collaboratively together with the member. Now this slide's talking about how it works. We give a lot of ways to get referrals into case management. UM is just one of the many ways that we get them there. We have risk stratification, reporting, predictive modeling, lots of different medical directors, a lot of sources that feed into how we work with our members. The biggest kick, we just need to get them. And once we get them, our supervisors are reviewing the referrals, triaging them appropriately, and making sure that they're getting assigned to the clinician that's best suited to work with that individual. Many times it's two clinicians. If we have a nurse involved with a registered dietitian or a nurse involved with a behavioral health specialist, so they can work together to get that member's needs met. All are always evaluating condition lists, and medication reconciliation is a constant part of that process, making sure that we're looking at the member's holistic healthcare needs. Our outreach is fairly similar across teams. Once we triage that member, we're giving them at least 3 phone calls, reaching out to the provider to get demographic information, sending at least 2 letters. And once we engage that member, our outreach is really very particular to what they need and how often they'd like to engage with us. We've tried to very much customize what that outreach looks like. What we're looking at here is kind of bringing it all together. More affordable alternatives to current medications if members are having difficulty with payment. So this is, again, an opportunity for us to work with the pharmacist in the pod of the day to really review what is the member taking, are there alternatives, are there cost savings opportunities, and kind of negotiating how we're going to communicate that to the member, how we could potentially work with the provider while not dictating service or dictating how the medication is being prescribed, just reviewing options and opportunities. Case managers can onboard members to WellFrame for an electronic medication reminders and education. WellFrame is our digital tool that we use, and every member has the opportunity to do so. But we have the chat feature available to our members who can get on, ask questions to the clinicians. We also have, like it says, medication reminders, articles for education, and also just opportunities to make sure that they're connecting to all of their appointments and follow-ups as needed. Case managers can outreach members with we focus on rising risk in addition to newly diagnosed conditions, and really try to offer a proactive approach to case management, proactive condition management by focusing in that way. If we work with the member upon discharge or upon a new diagnosis, we can really address the medication management portion early on and ensure that they have exactly what they need to be successful in their recovery or achieving and sustaining their healthcare goals. Members of the carve-in benefit for this, 40% more engaged in care management programs with the carve-out benefits. Additionally, carve-in members in care management programs are allowed a medical per member per month, 8% compared to carve-out members in care management. And I'd like to thank Kristen for getting those numbers for us because I was unable to obtain them prior to the presentation. And I think they really speak to the impact of case management. That 40% is a really great target, and we're hitting it, and we're successful in our outreach with our members. And with that, I'm going to turn it over to my very good friend and colleague, Molly, to speak to you about the high-cost claimant.
Thanks, Amanda. You teed me up there very nicely, so thank you. Good afternoon, everyone. My name is Molly DeVries, and I am the manager of the High Cost Claimant Team and Specialty Team. Specialty Team is our team of registered dietitians and respiratory therapists, and I'm excited to share with you all the high cost claimant approach to affordable pharmacy care. So high-cost claimants are members who exceed or are projected to exceed a certain threshold, 100,000, in expected costs in any given year. High-cost claimants can arise from acute situations or from poorly controlled chronic conditions that result in complex chronic advancing illness. The goal of this outreach is to provide the highest quality of care coupled with cost-effective treatment for these catastrophic diagnoses. This is achieved by utilizing a dedicated multidisciplinary team consisting of and not limited to registered nurses, pharmacists, behavioral health professionals, social workers, medical directors, registered dietitians, respiratory therapy, physical therapy, working to assist members in navigating the health system as well as better controlling cost of care, while improving health and quality outcomes. In addition, multiple specialties will co-consult on these cases that require specialization, such as the registered dietitians, respiratory therapists, and physical therapists. So through this complete approach, it resulted in $4 million in medication cost savings, cost avoidance as a result of pharmacy intervention in 2023. So High Cost Claimant team meets twice a week along with the concierge team and our adult safety net team for the High Cost Claimant morning huddle. This meeting provides workflow and referral log expectations. The weekly huddle consists of a multidisciplinary group of clinicians, inclusive of the medical directors, pharmacists that are dedicated to high cost claimant, utilization managers, and the case managers. And additional support will be included as needed, such as the social workers, registered dietitians, and behavioral health clinician. Pharmacy's role during huddle, they're responsible for reviewing pharmacy and medical drug claims data to provide cost-saving opportunities, identify pharmacy gaps in care, address adherence concerns, address drug-to-drug interactions, send clinical progress notes, and find opportunities for lower cost medications, acknowledge when a member needs pharmacy support, such as help with inhaler use, and assess authorization end dates for recertification or high end dates that may have lower cost alternatives available. And then from Morning Huddle, the pharmacist can recommend a referral be made to the high cost claimant pharmacist. The pharmacist will then receive that referral from the care manager. The pharmacist will perform a full medication therapy review, including looking up the member's specific pharmacy benefit, formulary, running a drug interaction checker, and assessing for lower cost alternatives, gaps in care, and cost savings associated with a 90-day supply or mail order conversion. In addition, the pharmacist reviews any medical drug for vial size optimization and dose rounding. The pharmacist engages with the member to address any medication-related concerns, including medication adherence, offers medication counseling, and completes additional outreaches to provider and pharmacies to ensure appropriate and optimized therapies. So let's take a look at a pharmacy success story that we have. A 53-year-old commercial member was trying to fill an expensive respiratory biologic medication for uncontrolled asthma. The pharmacy team noticed that the patient was filling their less expensive maintenance inhalers inconsistently, denied the medication, and referred this member to our high-cost claimant pharmacy case management team for outreach. Upon further review, the pharmacy and medical claims history, the member had multiple steroid taper fills between January and May and noted nicotine dependence. The member stated that the inconsistent inhaler fills were due to the presence of oral thrush caused by improper inhaler technique and an inpatient stay for uncontrolled asthma. The member also expressed difficulty with smoking cessation and stated they were ready to quit but tried multiple agents with no success. Our pharmacist counseled the member on the importance of inhaler adherence, correct inhaler technique, and proper oral care. Additionally, with significant coordination among the pharmacist, member, and provider, a new prescription was started to aid in smoking cessation. 3 months later, pharmacy followed up with the member to assess their asthma control and smoking habits. The member successfully completed a 12-week course of smoking cessation medication and was able to cut back from 2 packs a day to 10 cigarettes a day. The member remained motivated with their quitting efforts and continued to wean with nicotine gum. The member also remained compliant with their maintenance inhaler regimen and has not missed any doses and has not needed a course of steroids in over 3 months. This resulted in a $3,600 a month savings in drug cost avoidance. Thank you so much for your time today. I'm going to hand it over to Chris now to speak to our AQUAs. Thank you.
Thank you very much, Molly. So my name is Chris. Like I said, I work in the pharmacy department. I oversee our teams that work with our accountable cost and quality agreements. And to start, we're just going to show you a brief video to give a high-level overview of what our aqua arrangements are.
You have control of the screen, Chris.
Okay. So that's a very high level overview of what Aqua is. So to get a little bit more in depth about it and how pharmacy plays a role, I just want to give a little bit of background into how these arrangements work. So we enter into these arrangements with health systems and we work with, it's based on primary care physicians. So we get a roster of physicians, and at that point, we'll take our members, and based on what primary care physician they're seeing, we'll get assigned to an arrangement. And then what we do over the course of a year, we'll measure all of their healthcare expenditures. So whether it's in pharmacy, whether it's in hospitals, physician visits, wherever the spend is, they're going to be held accountable for it. And so where pharmacy comes in is our role is to identify opportunities and provide actionable reporting for those groups to impact those costs that are being spent. And so the way we do this in pharmacy is through a couple different ways. We really try to look at promoting cost-effective prescribing. So looking at alternative drugs that maybe have generics available or other alternatives that are lower cost. Different savings opportunities, which include reporting, looking at maybe members are on 2 drugs when they could just be on 1. Are there opportunities to combine into 1 to help improve their adherence and save money? And finally, quality improvement. So how do we ensure our members are being adherent to the medications? Are they on the appropriate drugs for the disease states? But we take our data and we turn that into actionable reporting. And so the pharmacist will then work with our aquas and provide clinical insights and potential strategies for rolling out new initiatives. And I think that's one of the big benefits to these relationships is we're able to collaborate and work with them. So what may work for one of our aquas may not work for another. And we have that insight and can adjust and help meet them where they are so they can have the biggest impact on our members. But as the video said, and that's going to be our theme, it's really about the collaboration and the relationships. It's definitely different from the typical, I'll just say, managed care relationship where it's the insurer telling them what to do. By leveraging these aqua relationships instead, it's more of a back and forth conversation. We work with our aquas and then they have those conversations with their physicians and their patients. So that way it's not coming from us, it's coming from their own PCPs. So over the years, we've done a lot of great work. Over the past, from 2019 to 2022, we've saved about 36 million. That number continues to increase each year as we identify new initiatives. As you can see on here, about $6.68 lower cost per prescription for members due to a lot of our work. We're able to focus on new and upcoming drugs before they even released. We can work with our providers to help make sure that they're being prescribed appropriately. As Amanda talked about earlier, biosimilars is one of our other big focuses. Obviously, specialty is a huge spend in the pharmacy space. And so we've been doing extensive education and collaboration with our aquas to help physicians understand what a biosimilar is, how they can prescribe it, how it works, can it be changed with a brand name? We've been answering all those questions just to help get the physicians on board with it because there is significant cost savings. We've also done unique programs with some of our aquas. We have pharmacists that are directly in the provider offices, and those pharmacists are working closely with those providers to just work up the patient list that we provide to them. We've done a lot of different other innovative programs as well. But as I said before, our goal really is collaboration and just a unique way to kind of work with our providers as well as our members, utilizing the physician relationship. And with that, I'm going to turn it over to Amanda to talk about what's coming in for 2025.
Thank you, Chris. All right, what's new for 2025? So for all groups, eliminating the diabetic insulin copays. So according to the American Diabetes Association, people with diabetes have medical expenses that are 2.6 times higher than people who do not have diabetes. To improve access and affordability, we support the New York State mandate to eliminate the cost share, including the deductible for diabetic insulin. And for small groups, $0 tier 1 drugs for children. Tier 1 drugs for children up to the age of 19 will now be covered in full, subject to the deductible where applicable. This update applies to all non-standard plans. And with that, I'll turn it over to Kristen to close the show.
Thank you to all of our speakers for sharing your insight today. We did not have any questions come through, so with that, it is going to wrap up our session for the day. This recording will be getting sent out and published to Univera Healthcare Sales Hub as well. So if you would like to share this recording with anyone, please feel free to do so and have a great rest of your day. Thank you.
Thank you.
Thank you.